What is a polyp? A polyp is a small growth bowel, and they're very common, and there are several different types. Most of them are benign, but some can become cancer if they're left in. Now, these sorts of polyps usually don't cause any symptoms, so most people with polyps don't know they've got them. However, if they become advanced, which is the stage just before they become cancer, they can sometimes cause some symptoms. The symptoms of large advanced polyps are really the same as with bowel cancer. Those are bleeding from the back passage, blood in the stool, or a change in bowel habit. How are polyps detected? Because polyps are mostly not symptomatic, generally they're not picked up in people who have symptoms. They are often picked up when people go to the doctor and have investigations because of other symptoms. For example, things like blood in the stool or change in bowel habit. Most polyps are actually picked up under the screening program. What screening means is that we are looking for polyps before they become either advanced or before they become cancer. And polyps do increase in frequency with age. So the bowel cancer screening program in the UK is aimed up at picking up polyps and dealing with them before they become bowel cancer. When should you see your doctor? So anybody should see their doctor if they are getting symptoms. And the main symptoms that we're looking out for advanced polyps or for bowel cancer are blood in the stool, blood on wiping, or a change in bowel habit. Now, the change in bowel habit can be diarrhea, it can be constipation, it could be a mix of both. If normal for you is going to the toilet once a day, then a change can be anything that is significantly outside that. But not everybody goes to the toilet once a day. Sometimes normal is once every 3 days or 3 times a day. So if there's been a change in your normal bowel habit, that would prompt you to see a doctor. Does having a cancerous polyp mean you have bowel cancer? Most polyps are not cancerous. They are what we call pre-malignant, which is pre-cancerous. And some are completely benign and have no cancer potential at all. But a few polyps do have little cancer inside them. And those we treat very similarly to full-blown bowel cancer, in that when they are removed, if a cancer is found, then most people will go on and have further tests to make sure that they don't have any cancer anywhere else. What happens if the polyp contains cancer? So if we remove a polyp and that has shown a focus of cancer that we were not expecting, usually what we would do is check under the microscope to see whether that polyp has been completely removed or not. We would usually go back and check the site to make sure that there's no polyp remaining. And then, depending on what the patient and the doctor wishes, we may then decide to do either intensive surveillance, which means going back and looking at that area more regularly, or some people will opt to have a full cancer operation just to ensure that there is no significant spread of cancer to lymph nodes or other parts of the body. So the bowel cancer age. Bowel cancer increases with age. About 40% of all bowel cancers are in people over the age of 75, but 60% of cancers are in younger people. And we know that the incidence of bowel cancer in young people, so under the age of 50, is massively increasing. It has doubled in the last 10 to 15 years. The screening program in the United Kingdom starts at age 50, and that involves doing stool tests for blood every 2 years. If that stool test comes back positive, patients then get either a colonoscopy, a camera test to have a look around the bowel and remove any polyps or detect cancer, or a CT colonography, which is a CT scan, which again looks for polyps or cancer. But patients under the age of 50 are not eligible for that program. And so therefore, anybody who is young, who has any of the concerning symptoms, needs to see their doctor to then go and get tested. So if you have symptoms and your doctor decides that you need an investigation, the likely test that you will have is a colonoscopy. That is a flexible camera test which wiggles around the colon and has a look at the lining of the bowel to check for polyps or cancer. Colonoscopy is usually done as a day case test. It usually takes about 20 minutes to half an hour and is not as uncomfortable as most people would think. Probably the worst part about it is we have to give patients bowel preparation, which clears the bowel out the night before. That gives you terrible diarrhea, but it's really important to make sure that the colonoscopist can have a really good look at the lining of the bowel and pick up any polyps that they find. The test can be done with sedation, so people can be made sleepy and comfortable, and we then have a really good look, and if we find any polyps, it's usually safe to remove those at the same colonoscopy. An alternative test for investigation, which can pick up polyps but can't remove them, is a CT colonography. This still does involve a little bit of bowel preparation, and it involves having a thin tube into the bottom with some gas put up, and then a CT scan with a patient lying on their front and on their back. This is a very good test for picking up polyps or cancer, but of course it can't remove anything, which is why colonoscopy is considered the gold standard test. If patients were to have polyps at a CT colonography, they would then need to go on and have a colonoscopy to remove them. If you are concerned, do go and see your doctor, particularly if you have symptoms. If you want to talk about screening for polyps or colorectal cancer, please do contact us at OneWelbeck. We are available on level 7 in the Digestive Diseases Centre, and endoscopy is on level 2.